Hi everyone, welcome back to the channel. Today we are going to talk about something very important in healthcare. The preoperative phase. If you ever wonder what happens before a patient goes into surgery, this video is for you. Okay? Whether you are nursing student, medical student, or just curious, I break it down in a simple and clear way. Let's get started. The preoperative phase refers to the period of time from when a patient decides to undergo surgery until they are transferred into the operating room. Okay? This phase is very important because it prepares the patient physically, mentally, and emotionally for the surgery. It also helps reduce risk and complication during and after the procedure.
Now let's talk about the goals of preoperative care. Preoperative care has three main goals, and all of them are very important to ensure a safe and successful surgery. The first goal is to ensure patient safety. This includes identifying any potential risks early so that complication can be prevented before the surgery begins. The second goal is to prepare the patient both physically and mentally. Physically, the patient needs to be in stable condition for surgery.
Nice.
Mentally, patients often feel anxious or scared, so they need proper explanation and emotional support.
Oh my god! Wow!
The third goal is to prevent complications during and after surgery, such as infection, bleeding, or respiratory problem. In this phase, nurses play a very important role in ensuring these goals are achieved through proper assessment, preparation, and patient support. Next, we move on to the preoperative assessment. Preoperative assessment is one of the most critical part of the preoperative phase because it helps determine whether the patient is ready and fit for the surgery. This assessment can be divided into three main components, which is health history, physical examination, and diagnosis test.
Yeah, boy.
The first component is health history. This includes obtaining information about patient medical conditions such as diabetes, hypertension, asthma, or heart disease. Any non-allergic, especially to medication or latex, and previous surgeries, and whether the patient experienced any complication before. And the next one is current medication including drugs and supplement. This information is important because existing health problem or medication may affect the surgery or anesthesia. The second component is the physical examination. During this stage, the nurse checks the patient's overall physical condition before the surgery. This includes monitoring vital signs such as blood temperature, pulse temperature, and breathing rate. The nurse also assesses the patient's respiratory system to make sure the patient is breathing properly, and check the cardiovascular system including the heart rate and heart rhythm.
Nice.
If there are any abnormal findings, they must be reported to the doctor immediately to avoid possible complications. The third component is diagnostic test. Before surgery, patients usually need to undergo several tests to make sure they are fit for the procedure. This may include blood tests to check the patient's overall health condition, X-ray if needed, and an ECG, especially for older patients or those who have heart problems. These tests are important because they help the healthcare team identify any problem or risk and make sure the patient is medically prepared for surgery.
Hello everyone. Today I'll be explaining an important part of patient care before surgery,
Stop it. Get some help.
which is preoperative preparation. First of all, before any surgery, patient must be given informed consent. This means the patient should clearly understand three things.
Oh my God! Wow!
The first one, the procedure itself, what surgery will be done. The second one, the risk and benefit involved. And third, any alternative treatment available. Only after understanding all of this can the patient sign the consent form. It's important to remember, the doctor is responsible for explaining the procedure. However, nurses play a key role by making sure the patient truly understands, answering questions if needed, and witnessing the patient's signature. This ensures the consent is valid and ethical. Now let's move on to the next one, which is physical preparation before surgery. First is fasting, also known as NPO. Patients are required to avoid food and drink for about 6 to 8 hours before surgery. This is important because it helps prevent aspiration, which is when stomach contents enter the lungs during anesthesia. Next is skin preparation. The surgical area is cleaned and sometimes shaved to reduce the risk of infection. In some cases, patients may need bowel preparation, especially for abdominal surgeries. This helps clear the intestines before the procedure. Patient must also remove personal items such as jewelry, denture, and nail polish. This is done for safety to allow proper monitoring during surgery. Lastly, an IV line is inserted. This allows healthcare provider to give fluid and medication quickly during surgery. In summary, proper preoperative care includes both informed consent and physical preparation. These steps are essential to ensure patient safety, reduce risk, and promote a smooth surgical experience.
Hello everyone, my name is Hazi, and today we are discussing the two pillars of preoperative nursing: psychological preparation and preoperative education. Many people think surgery starts in the operating room, but for a nurse, the work begins much earlier. Our goals is to prepare the both patient, mind and body for a journey ahead.
No! God, please, no! No!
Okay, first, let's talk about the mind. Surgery can be a terrifying experience. High level of anxiety can actually lead to psychological stress, which complicates recovery. This is why psychological support is vital. As a nurse, we follow three core steps. First steps, explain procedure clearly. We remove the fear of the unknown by walking them through exactly what will happen. Step 2, answer question. We give the patient a voice. No question is too small when it comes to their safety. Step 3, provide reassurance. Sometimes a calm presence and a listening ear are the best medicine we can provide. The result? A calm patient is more cooperative, requires less anesthesia, and experiences smoother outcome. The second pillar is education. We teach patients today the skill they will need tomorrow. If we wait until after surgery when they are groggy or in pain, they won't learn effectively. We focus on our major areas. First, deep breathing and coughing. We teach them to take slow, deep breath to expand the lung. If they have an abdominal incision, We show them how to splint the area with a pillow to cough safely. Second, early ambulation.
Nice.
We explain that early ambulation, simply getting out of bed and walking, is the best way to get the body system moving again. Third, pain management. We discuss the pain scale and reassure them that we will stay ahead of their discomfort. Okay guys, you might wonder why we spend so much time on this exercise. It's because they are life-saving. Deep breathing prevent pneumonia and walking prevent blood clots or DVT. By combining psychological empathy with practical education, we ensure that our patients don't just survive their surgery, they thrive in their recovery too.
The preoperative checklist is a final safety procedure done before surgery to reduce mistakes and complications. It helps the surgical team confirm that the patient is ready for the operation. First, confirm patient identity. Ensure the correct patient is going for surgery by checking name, ID band, and medical records. Second, confirm surgical site. Make sure the correct body part and correct procedure will be performed, especially for left and right for the site surgery. Okay. Third, ensure consent form is signed. Make sure confirm the patient has understood the procedure, risk, and has given permission for surgery. Fourth, check vital sign. Assess blood pressure, pulse, temperature, respiration, and oxygen level to know the patient's condition before anesthesia. And for the last, ensure patient is fasting. Check the patient has not eaten or drunk, as instructed to prevent vomiting or aspiration during anesthesia. This checklist is important to improve patient safety and ensure a smooth surgical procedure. Oh my God! Wow! So, that's a complete overview of the preoperative phase. To summarize, it starts when surgery is planned. It focuses on assessment, preparation, and education.
Yeah, boy.
It plays a huge role in patient safety and successful surgery. If you found this video helpful, don't forget to like, share, and subscribe. And if you want more healthcare contents like this, let me know in the comments. Thanks for watching. Bye-bye.